Good afternoon and welcome to the COVID-19 update on Channels Television. I am Kayode Okikelu. Here are some of the highlights. Zamfara State gets new molecular laboratory to test for COVID-19 as the NCDC advises states to step up their response. Economic activities are gradually returning to the new normal in Akwa Ibom State, first with the opening of markets, and now livestock trade is back. It's a mixed bag in Australia's state of Victoria. On the one hand, daily cases are dropping. On the other, it records its deadliest day on record. Thank you for joining us this afternoon. We begin with an update on Nigeria's COVID-19 figures as released by the NCDC. 417 new cases mean Nigeria is now closer to the 50,000 mark, with 49,485 total confirmed cases of the virus across the country. The total number of discharges are also on the rise as 337 patients received a clean bill of health, bringing Nigeria's total discharges to 36,834 and 977 deaths, with 2 new fatalities in the last 24 hours. Here's a breakdown of the latest figures across 16 states and the FCT, with Lagos recording 207, Kaduna 44, Ondo 38, Abia 28, Anambra 21, Plateau 20, Bauchi 13, Oyo and Mboyi 9, Delta and Edo 7, Enugu 6, Niger 3, Gombe 2, Ogun, FCT and Kano 1 case each. Well, Nigeria's testing capacity has been boosted with the addition of a new testing center, the Federal Medical Center Gene Expert Laboratory, Gusau, in Zamfara State. Well, this means Nigeria now has 64 laboratories with the capacity to test for COVID-19 across 31 states and the FCT, with Kebbi, Niger, Taraba and Bayelsa being the 4 states yet to be added to the NCDC lab network. Nigeria has so far conducted 352,625 tests, with an average of 3,000 tests daily. However, Nigeria's tests per million is still less than 5,000, as only about 0.2% of the nation's population has been tested for COVID-19. Let's head over to Adamawa State, where the government says it will take punitive measures against any school principal who fails to adhere strictly to the COVID-19 protocols on the conduct of the West African Senior School Certificate examinations in the state. The Commissioner for Education, who went round schools in Yola, the state capital, to ensure the compliance, says that government is very serious to ensure that the lives of students are protected from the dreaded COVID-19 by preventing its transmission.
Life here. We are not joking about it, because you, as the manager of the school, you refuse to talk to the children, the students, to adhere strictly to the guidelines of COVID-19. Then you have to blame yourself. We are not going to take it kindly. We'll seriously deal with you, because you are joking with life. And life of the Adamawa State is the life of one child. It's life of Adamawa State. We won't take it lightly, please.
There are so much challenges because the government have made a provision of all what is required. The buckets, the hand wash, soap, the temperature scanner have been provided for the compliance of the COVID-19 guidelines. I believe we have done our best, and the government have done their best. There's almost like 3 other secondary schools joined to my school to write the exams. That's why we have that high number. If it is only this college, the total number of students in this college are just 485, in which this 2 halls can contain them by observing the required social distance.
Well, let's head over to Akwa Ibom State, where the government has announced the reopening of livestock markets from 6 a.m. today. In a press release signed by the Secretary to the State Government and Chairman of the COVID-19 Management Committee, Dr. Emmanuel Ekoem, the state government said the decision was made in agreement with livestock dealers in the state. The market had been closed by the state government in May as part of measures to curb the spread of COVID-19. And now that the markets are open, the government is asking for strict adherence to COVID-19 guidelines by dealers and the general public at the markets. And the Enugu state government has reviewed the operating times for tricycle operators, otherwise known as keke riders, markets, restaurants and bars in the state. And that's in respect of cautious easing of COVID-19 lockdown in strict adherence to NCDC protocols. In a statement by the secretary to the state government, Professor Simon Otwaya, the tricycle operators, popularly known as keke riders, will with effect from tomorrow operate from 6 a.m. to 9 p.m. daily. According to the statement, markets within the state will also from tomorrow operate between 8 a.m. and 6 p.m. daily, while restaurants and bars will operate from 6 a.m. to 7 p.m. The statement added that all nightclubs in the state are still barred from operation till further notice. Well, let's talk to Professor Christian Happy, Professor of Molecular Biology and Genomics at Redeemers University. He joins us via Skype this afternoon. Thank you for joining us on the program. You know, just yesterday, I was speaking with one of our guests, Dr. Japheth, and we touched on different strains of COVID-19. Now, from that moment, I could not get it off my mind to think that there are different brands, so to speak, of the virus. I know it's something you have been exploring. So what do we know about that now?
Thank you for having me on the program. What we know about it is that there are 10 different lineages circulating in Nigeria at the moment. 10. And those lineages are coming from, multiple introduction from several areas in the world. From Europe, from Asia, from the US, from Saudi Arabia, from Australia, from other countries within Africa. So we've identified 10 different lineages circulating in the country at the moment.
So when you say 10 different strains, does that mean their symptoms are different, mode of transmission is different, you know, maybe the fatality rates from those strains are different? Really, what does that mean?
Well, if you read my lips properly, I said lineages, which is different from strain. Strains are, viruses of the same class, but we have different modes, that we may have different modes of transmission or pathogenesis. I talked about lineages. Lineages are the same virus, but they're a little bit different. They are what we call in genetic divergence. So they are moving and evolving at different pace and evolving in different direction. So they have not formed what they call lineages yet. So they're still the same strain, but different lineages.
Right. I think it's good.
And all over the world, there are 98 lineages of the same virus overall. Okay. We haven't said that there's a new strain yet.
Right. So just to stay on that, it's good. I'm getting schooled here by an expert. But so what is the difference really? Strain, because there are people that have said there are different strains, but you're saying now they're lineages. So what is the right information to put out there so we don't spread the wrong type of information?
We have one strain of SARS-CoV-2 in Nigeria and 10 different lineages of the same strain. A strain is a virus of the same class who can cause different ways of manifesting the disease. In this case, we have not established a new strain. We still have one single strain, but then 10 different lineages. Lineages are like children from the same strain, but that are evolving, differently. Eventually, maybe over time, some could evolve to become independent strain, but we're not there yet.
Right. Thank you for clearing that up. Now, let's talk about new trends, really, in this response to COVID-19. Just yesterday it was announced that we're opening up to international travel from August the 29th. So, there's just one strain, like you said, of COVID-19. Do you see any dangers in opening up? What are the possibilities, the eventualities that might come up as a result of that?
Well, if we are doing testing, just like anywhere, there's the possibility that some people may bring new lineages of the viruses, from outside the country into Nigeria, as we saw clearly that the first a set of lineages of the virus that came into the country were multiple introductions from different countries across the world. So it is possible that we may be having additional additional lineages of the virus coming into the country. And it is also possible that some people that will be positive from here, probably not showing symptoms, and then still showing negative qPCR data at the time of traveling, maybe going out of the country with lineages from Nigeria. So we should just be ready. We should just keep testing, and then that requires a lot of more testing, and then ensuring that we're on top of the game. So that is just a risk. I mean, there's a risk associated, with travel, and then that's definitely we should be ready to, to tackle those risks.
So, I mean, in terms of modality, what kind of modalities do you think should be in place? I recall the UK over the last weekend, announced that people coming in from certain countries will have to quarantine for a specific period of time. And, a lot of people are trying to rush in just to beat that. So what kind of modalities or protocols should be put in place for people coming into Nigeria, for example, now that we're opening up to international travel?
I don't think that the NCDC have a regulation similar to the one that you see in the UK. I think NCDC says that people coming in have to quarantine for 14 days. I do hope that people will respect, those regulations, that they will really quarantine for those 14 days and then eventually go and then test and then ensure that they have a negative test before they get the password. I think if we all embrace the regulation by the regulators in Nigeria, through the NCDC and then the Prudential Task Force, I want to believe that we'll overcome. I think it's all about people complying.
Well, let's talk about our numbers. We recorded 417 in the past 24 hours. Now, I mean, it's not as high as it used to be. I mean, we used to have 600 and the rest. Now, I just wonder, how do you interpret these numbers? For a lot of people, they're jubilating, thinking, well, I mean, the worst is over. But for you, when you see those figures, I mean, when you analyze what we've had so far and you look into the future, what do you see?
Well, I think we have that natural tendency of declaring victory before even the battle is over. I would say that the battle is not over, and it's not over until it's over. If you look at the numbers, I don't think we are far away from what is happening all over in the UK, I mean, in the US, for instance. Let's compare the number. If you compare the numbers Africa-wide, if you look at the number of Africans that are dead, that is 25,000. If you look at the number of confirmed cases, we're about 1.2 million or 1.3 million. If you do the ratio, you realize that we're about 2%. If you come, the same applies for Nigeria. If you look at the total number of cases, we're less than 50,000 and we're almost 1,000 dead. If you do the ratio, you realize that we're probably close to 2%. If you go to the US, for instance, and then look at the number of people that they confirmed cases, they are over 4.5 million, for instance, and then you talk about number of positive cases, they're probably over 165 or 168,000. If you do that ratio, they're just about 3%. So the question is it that different? The answer is no. I think we just have to be very careful. You're hearing higher number of the case fatality rate in the US, but also compare that to the number of confirmed positive, you realize that we're not that far off though. So I think we just have to be very cautious. We have to continue, doing what we've been doing since the beginning, and then without screaming Uhuru before it's too early. Without screaming Uhuru too early. I think it is a challenge for everyone, and we should continue to work relentlessly without claiming that without claiming victory, because it's too early to claim victory over this very new coronavirus that we're all learning about every day.
Well, Prof. Happy, just before we round off on this conversation, I'd like to know briefly, what's the single most important lesson that COVID-19 has taught you?
Well, I think the single most important lesson that COVID-19 has taught me is that the world globally is very unprepared. And it's also clear that, we as human beings don't learn from our mistake and from the past. If we have learned from Ebola, we probably would have been better prepared now. Globally, we have not learned. And I'm hoping that, from this, we'll practically sit back and then together work as a global community and then in different countries come up with a pandemic preemption system that can enable us, to prepare better for the next future pandemics. It is very important that at this point, we start working together to set up what I call an early warning system that can enable us to respond better and to preempt future pandemics.
So global cooperation for you, Professor Happy. But I'd like to thank you so much, Professor Christian Happy, Professor of Molecular Biology and Genomics. Thank you so much for sharing your thoughts with us this afternoon.
Thank you, sir.
Wuhan in China was once the world's epicenter of coronavirus, but the pictures coming from there might shock you. We'll have more on that when we return. Please stay with us. You're welcome back. For 20 weeks, religious centers were closed for worship in Ekiti State as a result of the gradual spread of a novel COVID-19 pandemic across the country, with the state recording the first case on March the 15th. Now the hurdle has been crossed with the regulated resumption of public worship. So let's join our correspondent, Babajide Agbeyo, who captured the mood and activities.
It is not that we are satisfied, because seeing all children below the age of 12 staying at home in this time of crisis, we have crisis in the whole world, and those above 65 to stay at home, we are not happy, but we just have to comply because it is for our good, and I know it is not going to be forever. It is just for a meantime that the government will soon review it and allow those people to worship God together with us.
The Minister of Environment came here, fumigated the whole mosque. That's one. We have bought water, kegs, we have bought all the materials being used for this thing, believing that we will resume earlier than this time. So therefore, we met all the requirements of COVID-19 pandemic rules and regulations.
Well, clearly the war against this public health emergency is far from over. So let's join Dr. Shalom Oni, a public health physician. He joins us right here in our Lagos studio this afternoon. Thank you for joining us.
Thank you, Coyote.
You know, let's see if we can pick up from where we stopped with Professor Happy. What is the single most important lesson that COVID-19 has taught you, perhaps as a public health physician, as an individual? Let's start from there before we move on to other things.
Well, the most important lesson I've gotten from this COVID-19 so far is that if you don't put systems and structures in place, you are going to be badly hurt by any form of health-related events going on in the world. So Nigeria, as a country in Africa, we must put our hearts together and ensure that we don't pay lip service to health infrastructure anymore. Look at the Nigerian budget. As of today, there's an Abuja declaration. As of today, we are still struggling to keep up with Abuja declaration that talks about the percentage of health budget that must go to health. So it's a whole lot of things. We have been advocates have been ongoing on this. Government have been lobby groups have been talking to the government to ensure that health department is well funded. So going forward, if we don't put our hearts together, because when pandemic comes, you won't be able to travel out to Europe, to Germany, where you get this treatment top class. So invest in the primary health center, invest in general hospital, and invest in the tertiary too, so that we are fully kitted when such cases come up.
You know, if you could rate our response so far, how we have put those structures and systems in place from, let's say, February the 27th, when we recorded our index case, to this moment. If you could give us a scale of 1 to 10, how would you rate us so far?
Well, I would rate Nigeria 5 over 10.
That's average.
Average.
Okay, well, let's talk about our measures. So schools are gradually reopening. You just saw religious centers reopening across the country. Domestic flights have resumed. International flights will resume in the coming days. Do you really, I was speaking with Professor Happy, we're talking about eventualities. Do you foresee any, and do you think we're prepared for that? You've rated us average, by the way, but do you think we're prepared for the eventualities?
Now, let me pick up from where Professor Happy stopped. Right. In Europe, they have 14 strains already.
Strains, not lineages?
Sorry, variants already.
Okay, right.
Variants. In fact, there is when COVID-19 kicked off, we had the D614. But now there's a mutation to D614G. In fact, the current global spread we are having is as a result of D614G. It's there. The statistics are there in Turkey, in UK, in Russia, all over. However, I'm starting with the international flight now.
Right, go on.
The tendency of importing a strain another strain, or another lineage, according to the prof. It's very high. So this is the time when we must give the molecular biologist a voice. They must come on board to ensure that we come up with the right surveillance system. In fact, they must be well funded right now, so that those who are being quarantined, those who are going in and out and being quarantined, they go beyond just testing. You are also doing a genomic sequencing
So you're a step ahead, as it
for
were.
those who are positive, so that if there's a new entry of a strain or another genome in Nigeria, we can pick it. He rightly said that we have 10. But with this opening of international flight, we could have more than 10 in the next couple of weeks. So our surveillance system, our molecular biology surveillance system must be strong, so that at every slight entry, we are able to pick a new entry.
Wow. And do you see us doing that already?
Well, for me, I think we have the capacity to do it when we are willing to.
Oh, this is something I've heard a lot. We have the capacity, but we're not deploying it as we
So
ought to.
we need to put our hands together and do it. We need to actually come to the table and do it.
Okay, so we can do it, right?
We can do it.
Okay, let's talk about this, home care. I know it's a topic that was talked about at some
Severally,
point, but
yes.
it appears to me as though there's no template, really, that people can say, okay, this is how to go about it. I mean, you have said, health experts have said there's a tendency to maybe overwhelm our health system. So maybe we should look at home care. Is there anything about that?
Yeah, something has been going on home care. But let me start by saying home-based care of COVID-19 kicked off by default. How do I mean? Around May, June, the government declared, especially in Lagos, that the number of cases, that are COVID-19 cases on the streets, are more than the ones in isolation. So as a result of that, home-based care has already kicked off on the existing structure of surveillance that is at the local government and ward level. However, there has been some training ongoing by National Primary Care Development Agency, even by State Ministry of Health. They've been training laboratory health workers, they've been training logisticians, and they've been training doctors and community health workers that will now ensure that at least you do a visit to a positive COVID-19 case in their house, then you complete the 14 days or 21 days, as the case may be, by phone.
While the care is happening at home.
It's happening at home. So the structure now is kicking off. However, the home-based care thing has kicked off, by default.
I mean, it started way before we even...
Exactly, that's it.
Wow, I mean, great insights there, Dr. Shalom Oni. But I'd like to thank you so much, public health physician. Thank you for your thoughts.
Thanks for having me.
Well, let's head outside the country. Wuhan, China used to be the epicenter of the coronavirus pandemic when it first hit the world. Well, over 6 months after, many countries are still battling to contain the spread of the virus, but it seems that Wuhan is back to its old normal. Well, pictures from the weekend show thousands of people packed shoulder to shoulder with no face masks in sight, frolicking on rubber floats and cheering along to a music festival. Well, it's not a very 2020 image, if you ask me, but it was a scene this weekend in the Chinese city of Wuhan, where COVID-19 first emerged late last year. We'll take a look at our website, channelstv.com, where you can get access to stories in different areas from business, health, politics, sports, Africa, and around the world. Like this one, Nigeria confirms 417 new COVID-19 cases set to resume international flights, and so much more, all at your fingertips. Well, that's a COVID-19 update. Thank you for watching. I am Kayode Okikiolu. Do stay healthy and stay safe.